Hi, everyone. Welcome to my session today. Apologies for starting just a tiny little bit late, but thank you for joining the stream live. And for those of you watching on replay, welcome. Today, we're talking about endometriosis. And before I get into the subject, how are you all doing? We've crossed into September, so we're heading quickly down towards the end of 2022. Wow, what a year it's been. So I hope you're all doing well. On this channel, we talk about everything to do with women's health, family health, sexual health. So if this is the first time that you're finding this channel, you're welcome. And please go and have a look at the different videos and playlists that we have, answering so many different questions about women's health problems, gynecological issues, pregnancy-related issues. But we're also there for men. We talk about things to do with sexual health, general health, family health. We're also there for children and for your mental health. So we are a total package. Today, we are talking about endometriosis. We're looking at this condition. I've actually decided to make it a series because there's so much to talk about endometriosis. And we can't do it in one session, is the way to put it. So there's a lot to talk about when it comes to endometriosis. And I've decided that we're going to look at it in phases. We may do a couple of sessions and then take a break, but I'm going to keep building on this series till at least I've covered a big chunk of frequently asked questions around endometriosis. So there's going to be a playlist on this particular subject, so go and have a look at it, probably starting today, and we'll do the same again next week. And I think by the end of this month, we should have a nice, good, big playlist for the just endometriosis series. And I do have other videos on endometriosis just on their own. So make sure you can have a look at that if you want to look at specific things around treatment, around symptoms. In this series, you're doing question and answer. So it may be that you just want a little bit of information about a specific area, then the endometriosis series playlist is what you need. If you want to address a particular area in depth, then there is the endometriosis section that is on the playlist section of the channel. So without further ado, let us get into it. I think I've got about 10 questions and I'm going to go through them fairly quickly. And welcome to anybody, before I forget, welcome to anyone who's joining the live. Leave a comment for me. Tell me where you're joining from, how your day is going. And if you have any question around the topic, then please feel free to ask your question or to share your experience, please, because we're all about trying to learn from each other. So with that said, let us get into the question. And I have to remind myself to encourage you to like the video and to subscribe to the channel. And please let me say thank you. Thank you to everyone. I think from the middle of August, or was it July? I think we're nearly at 1,000 extra subscribers since that time. So thank you to every new subscriber. Thank you to everyone who has commented or liked any of our videos recently. I appreciate you. Thank you so much. We are growing, and that tickles my heart. That encourages me and tells me that what we're doing is giving you value. Okay. Endometriosis. So the first one, obviously, is to talk about what endometriosis is. And I think the best way to put it is that this is a lifelong condition, or chronic. You might know it better as chronic or lifelong disease, where tissues that appear similar, they appear to be like the tissues that you find in the inner lining of the womb, appear in other parts of the body. So that's the definition of endometriosis. They can cause cysts to form in parts, in organs like the ovary, or they can form patches, tissue-like patches in other parts of the body. The reason it becomes relevant is, just think about it. The womb's inner lining is known as the endometrium. Let me just pull up I've got a couple of videos. So I'm going to be sharing some images so that we're all familiar. Let's use this one. Okay, so the womb's inner lining, so this is that bit where you see the egg traveling through, that's rimmed in red. That's known as the endometrium. Okay, now under the influence of the hormones, reproductive hormones, estrogen and progesterone, the lining changes at different stages of a woman's cycle. So for example, before ovulation, the lining becomes thicker because it's preparing to receive a fertilized egg. However, if no egg is fertilized or implanted, just as you can see in this video I'm sharing, the womb lining eventually breaks down Okay, it breaks down, and so what you get is that the womb is shed along with the egg is shed as menstrual period. Okay, but this is the same thing that will happen to that other tissue that appears similar to womb lining in endometriosis, and it's happening in other parts of the body, not in the womb. So you can see how this can be a problem. You can see how this can create issues. And this is the basis of the symptoms that generate or happen around endometriosis. Okay, right. The second question we're going to go to is how endometriosis is diagnosed. Now, don't worry yourself about, how the questions come. I've just pulled out a bunch of frequently asked questions. So they may not come in order of talking about diagnosis and then describing or defining the condition, describing the symptoms. But I'm looking at specific questions that people want to know about. So it might come in order, it might not. Hi to anyone who's joining the live. Tell me where you're coming from, how you're doing today. I really appreciate your being here with me along to discuss this topic. So welcome. Now, how is endometriosis diagnosed? I also have a really great couple of videos. So let's pull those ones up so that you're also in line with what I'm talking about. Now, to determine or to detect endometriosis, we need to look directly at a woman's reproductive organs. You need to be having a look inside. Okay, and usually this happens through a procedure known as laparoscopy, which is what I'm showing you in the video here. And you have a camera on the end of a device, a structure like a telescope. It's passed through small cuts in the abdomen. So this is not major surgery. Okay, you're not going to have major surgery, but little cuts are going to be put in place on your abdomen, the surface of your abdomen, on your tummy. And through those little cuts, the surgeons are going to be able to introduce a thin telescope that's got a camera. Excuse me. And that camera allows the surgeon and the team to have a look and explore the internal organs. And they can see the surface of these organs. They can see if they're the nice appearance, normal appearance, or if there's any form of abnormality or disease on the tissue. Okay, so this is the principal way that you can detect a person has endometriosis. What about an ultrasound scan? Because I know some people also ask, what about the use of an ultrasound scan? And that also has value when you're talking about endometriosis. It's also useful. In fact, if you come in with symptoms that suggest we should be doing tests for endometriosis, you're probably going to have a few tests before you get to laparoscopy. And one of them is an ultrasound scan. It could be an abdominal ultrasound scan. So the device or the probe is being applied over the top of your tummy, or it might be a transvaginal one, which is where the device or the probe is going to be passed through the vagina. And the aim is to have a look at the organs. You may be able to identify some abnormalities that way. But definitively, if you're looking at what is a definitive method of identifying endometriosis, then you're probably then what we need is a laparoscopy. And don't forget, ultrasounds can also help us to look at, to identify things like fibroids, might be useful in detecting things like ovarian cysts, excuse me, other causes of pelvic pain or heavy periods. And while I'm saying that, please go and have a look. Please go and have a look at my video. I have a video on the channel that talks about different causes of pelvic pain. So please go and have a look on the channel if you want to explore. There are quite a few of them. And this is when these studies, these different tests come in useful to help us to differentiate between the different causes. And you can also have tests like an MRI or CT scan. Again, they're looking at any structural abnormality, anything that looks different, out of the ordinary within the abdomen or pelvis. But as I've said, the best test, the gold standard, as what we call it, is doing a laparoscopy. So that's our number 2 question. And we're talking about endometriosis. So if you're just joining, welcome. I think I've got a couple of people joining in. And oh, hi there, I've got Sarah Adima Karimu, and you're joining from Sierra Leone. Great to have you today. I hope the weather's treating you well all the way in Sierra Leone. Thank you so much for joining. So we're talking about endometriosis, and we're going to the next question. And this question has to do with what endometriosis symptoms mean. So we're going to talk about the symptoms, we're going to talk about what they mean. And so by that, I'm just going to try and break down for you the symptoms and sort of put them in context in a woman's experience. So I'm going to leave this image on here because it lists the symptoms, but I want to sort of for us to talk through them. So we've already said at the beginning that this lining that creates the problem in endometriosis is similar to the womb lining. It's happening outside the womb, and this leads directly to the symptoms that happen. The blood that does the tissue in this endometriosis patches, the blood is trapped. Unlike when you're having your menstruation, the blood can leave through the vagina. It's shed through the vagina as menstrual blood. But in this case, the blood is trapped. It can't move away. And this blood irritates the tissues, causing inflammation. So it makes the endometriosis patches, the endometriosis cysts, it irritates the tissue, causes pain. So this is the primary reason that you have inflammation and pain. And pain is a big issue. It's a big issue. You can see that on this video, almost everything here has to do with pain, because one of the things that any woman who has endometriosis, particularly those with moderate, severe, and very severe disease, will tell you is the horrendous pain. And pain can be pelvic pain. So this is a state of just being uncomfortable throughout, whether you're having your period or not. But these patches and cysts and tissues, endometriotic tissues, wherever they're located, commonly within your pelvis and abdomen, are just disrupting the surrounding tissue. They're irritating the tissue around. And so ladies can be in a state of constant pain, whether or not they're having periods. They could also have pain in the back. They could have back pain, and that can also transmit to or refer to their legs. So you have women who might be experiencing pain in different areas as a result of this condition. They could also have painful periods. So they can have painful periods. They can also have irregular periods. So not only does the period come and there's a lot of cramp that is unusually painful, and I want to say it now, and I will say it many times during our discussion, that having painful periods is not status quo, it's not normal. And we need to be saying this more and more so that young women and our girls growing up now realize that it's not normal to be sitting down and experiencing severe pain, because when you're having your periods, that doesn't even allow you to move around. That's not normal. Yes, there can be some degree of discomfort with cramps, but they should be such that with some rest, it settles. Perhaps with a hot water bottle, it settles, and you can go about your business. But severe pain, excruciating pain, that you're crying, that's not normal. And we need to get away. We need to be saying to people who are trying to normalize that for us, we need to refuse that. Particularly for us women going through periods, for women who are younger, for young girls growing up, and so on, we need to be having that discussion and pushing back against that mentality. They could have painful periods, they could have heavy bleeding periods. They could also have irregular periods. So periods are either they're longer than usual, or they're shorter, or you don't know where, you can't plan with the period, you don't know when the next period is due, and things like that. So those changes can happen to the periods. There could also be, during the period, pain when you're passing stool, when you're opening your bowels, and that can be related to other bowel problems like feeling sick, bloating, constipation, and difficulties like that. There could also be pain when you're passing urine. There could be pain during intercourse, pain during sex. Very important. So you can see how this condition can affect the whole spectrum of life. It can do things to a person and affect your whole spectrum, affect your day-to-day activity, affect every single thing, can take over. Very important for us to realize and be conscious what women go through. And in addition to these other symptoms, women can have anemia leading to tiredness, exhaustion. Well, of course, that will happen because they're losing so much blood if they're having heavy periods. As time accumulates, they will become anemic and develop tiredness. And another big issue with endometriosis is infertility, problems having children. Up to a third of women who have endometriosis can have difficulty getting pregnant because that is the nature of the condition. So that's a really important aspect of its complications, or the issues that it can cause in a woman. So we're talking about endometriosis. We're looking at endometriosis issues and questions, tips around endometriosis. If you're just joining the live, welcome. Thank you for joining in. Let me know, where are you watching from today? If you want to contribute towards the discussion or ask a question, please drop a comment. It's great to have you here. Don't forget to like this video. Don't forget to subscribe to the channel as well if you enjoy the information that we're sharing. We do a lot about trying to educate women and families, and help us familiar with these conditions, to know how to raise a request for help, or to raise awareness. If you want to talk to your doctor about certain symptoms and you're not sure if this is what this is about, how to talk to your doctor, all those things, we like to talk about them. So these are some of the symptoms that endometriosis can cause. And don't forget, you might want to ask, well, how does it do all this? How does it cause this problem? For example, infertility. I'm going to dedicate a segment, because there's a question on that, how endometriosis causes infertility. But remember, for example, if there are cysts, if the endometriosis, those tissues form inside the ovary, can create cysts and prevent the normal egg release, affect ovulation. So you can just see how this thing can scale itself into such a big palaver in a woman's life. Okay. Right, so we are talking about endometriosis. I'm going to go on to question 4, and question 4 looks at the meaning, what endometriosis means. I know you'd say that sounds like a strange question to be asking. What I mean, when what endometriosis mean, what it can mean to people. Now, different parts of the body can be affected by endometriosis. More commonly, it all stays within the pelvis and the abdomen. And when the organs that are affected generally are the ovary. I think I have another. Yeah, let's look at this one. So commonly, you can have the ovaries and the tissues around the ovary and the tube, which support the womb, because the womb isn't just lying in space inside our pelvic area. There's some tissues that are holding the womb in its place where it is. So those tissues, as well as the organs like the ovary, the fallopian tube, can be affected by endometriosis. They could also, the endometriosis tissue can also affect the bladder and the bowel, the big bowel in particular, and even the kidney tubes. Okay, so it can affect quite a lot of different areas. So the meaning of endometriosis is that it's quite extensive, the degree of damage this condition can cause. It affects 1 in 6 to 10 women. The rough percentage is that it affects about 10 to 15% of women, is what from research that we know how big the burden of endometriosis in general society is. So that if you have a room with 10 women, we're saying that 1 out of 10 of them could have endometriosis, and it can even be more common than we think, so that 1 in 6 women might have endometriosis. So that's a significant disease. I'm sure you would agree. The other thing, I think, when you're talking about what endometriosis means, I think it's important to say that it affects women differently. We've just spent a few minutes going over different symptoms, and by no means was that list of mine exhaustive. So there are different issues. We didn't even talk about the mental health, and I promised myself that when discussing these issues, particularly chronic gynecological, long-term gynecological women's health problem, must never ever forget to talk about mental health. We talked about fatigue, but in one of my videos, I actually sat down and calculated the effect of heavy bleeding on a woman, the toll it can take from the time a girl starts having her periods right up to the time of her menopause. If you calculate the number of days of bleeding, how much blood loss happens, and the stress when it's heavy, particularly when it's heavy bleeding, when you're flooding and when you're having longer bleeding than normal, it takes a big toll on a person. And I know I didn't put that on the screen, I'm sorry, but it is one of those things. There are other symptoms that we'll look at, and one of them is the effect on one's mental health. So the point I was trying to make as well is that endometriosis, these symptoms affect women differently. You might have 2 ladies with endometriosis. They can have different severity. So somebody may have mild disease. Another person can have moderate or severe disease. Somebody may have endometriosis patches on the fallopian tube. Another person doesn't, and she might have endometriotic cysts in her ovary. So it's important to know that when we say endometriosis, while you're getting your head around this condition, it's important to realize that it can affect women in different ways. And this is why having a laparoscopy, which we've already talked about, that is important to be able to identify what type a particular woman can have. So that's what I think. These are some of the areas I wanted to look at, discussing what endometriosis can mean. So we're going to the next question. And this question says, what endometriosis feels like? You would need a woman. In fact, you need to talk to so many women with endometriosis to understand what they feel like, to do justice to this question. Okay, I haven't got anybody here that I can say, okay, let's talk about what your symptoms feel like. But I've poached somebody's comments from YouTube, and I hope she will excuse me, because I thought she was really giving good voice to her experience. So let's read through this. This is a lady who was responding to a video on endometriosis, and she shared her experience. And I thought it was so useful because it went from how, when things started, they didn't really know what was going on, to eventually where it was. And it just shows what it feels like in a nutshell. This is by all means not just not everybody's experience. Everyone's different, but I think this is a good picture. So this person says, I always wondered why I struggled growing up with such painful periods as a teenager up into adulthood. To find out, it also runs in my family, and approximately around the age of 22, I finally sat down with OBGYN out of concern from a relative who told me that it runs in our family, to find out that I do have endometriosis. And so that explains so much for all those years I had to suffer. And it sucks because I had to wait until I was in my 20s to find out. And throughout my teenage years, I just had to deal with it. It hadn't crossed my doctor's mind. It hadn't crossed any doctor's mind at some point back in the day. Maybe this teenager has endometriosis. Maybe we should give her some sort of treatment or birth control, and everything. So there is so much upset and angst in this. She goes on to say, to describe it, I go through intense pain. It triggers nausea. It has me balled up. I'm crying. I'm constantly throwing up. I cannot hold down anything. So yes, it is very excruciating. And if you feel like you're having any of these symptoms, please do, as soon as possible, talk to your OBGYN. It's better that you know earlier on than to find out later on. So yeah, I said I poached this comment. It's in the public space, but I thought it was a really good way to answer that question, what endometriosis feels like, from somebody who's lived through it. And I think for me, the painful thing is she talked about her teenage years having been thrown away, because you can imagine, she talked about excruciating periods. So she's 22, and from her teenage years, say from 12, 13, whenever she started having symptoms, 9 years of going through this, and nobody understood, nobody could factor it in. And sadly, we're getting better, okay? But back in the last maybe decade or 20 years, it was difficult to get a diagnosis of endometriosis. We doctors didn't even understand it, and it wasn't one of those things that quickly came to mind when a woman comes with heavy periods. And that's why I'm saying that we need to be coming away from this assumption that painful or heavy periods are normal. And we're doing that both as medical people and non-medical people, having that heightened awareness to think about these conditions. Particularly when a woman who is in her childbearing years comes in with very heavy periods, painful periods, there's certain conditions that we need to be thinking straight off: endometriosis, fibroids. We need to be making sure it's not that, and come away from the habit of just saying, okay, well, it's just because you're starting, here's a pill and off you go. Even if you're going to use the pill, and I do talk about this in another video, I don't want to get derailed or distracted on this particular subject. But even if you're going to start a person on the pill, it's good to monitor them, because if it's getting worse or it's not getting better on the pill, we need to be revising the diagnosis and looking at possibly doing tests to work out what's actually going on. So that was that question. Oh, and then she also talked about some of the symptoms you've mentioned. She talked about feeling nauseous. She talked about bloating, and just the impact on life generally. So in terms of the effect of endometriosis, what it feels like, I think it's really useful to share that with you. It can take a long time for diagnosis, and if you feel that you're not getting anywhere, I always say don't forget a second or a third opinion. I have the Askawayhealth email health information service. So that's our website that's linked here. If you go to the description box, if you wanted to chat through your symptoms and talk it through with a clinician like myself, use our email information service. We can go through this with you and say, do you know what, this is what we should be thinking about. So if you're worried and you think perhaps your own doctor that you see face to face isn't considering particular symptoms, come and talk to us. Let's sort of look at it together, and then sort of point you in the direction of what this could be, and what you could say, the talking points that you should have with your own doctor to look at further tests that could happen to help get your diagnosis. Okay, so we're talking about endometriosis. We're looking at tips. If you're just joining, hello, welcome to this the live stream. Welcome to today's class. Great to have you joining me. We're looking at endometriosis. This is a Q&A. Our series has just begun, and this is the very first one. I'm hoping that we should have maybe 5 or 6 by the time I'm done with this particular playlist series. So we're on to question number 6, and I promised we were going to talk about infertility, just put a little bit of a scope on infertility. So this question now is about how endometriosis causes infertility, or in other words, why endometriosis causes infertility. And if you were here from the beginning, or if you just want to, if you remember what we talked about at the beginning, how it develops and what kind of damage it can cause, you can imagine to some extent how it could affect a woman's fertility. However, we don't know all the ways it can affect it. So first of all, up to 1 in 3 women, up to 30% of women with endometriosis can have problems with fertility, problems getting pregnant. And we don't know why this happens in most cases. If a woman has very severe disease or moderately severe disease, where her organs are damaged by the tissues, because the endometriosis patches can be quite sticky. Because they're sticky, they can cause organs to stick together, and so they can't function normally. They can then develop scars. So it's not difficult to understand how that could prevent pregnancy. But sometimes women who don't have that kind of severe disease also have trouble getting pregnant. So there are other theories, that we have to look at. So for a woman who has severe disease, and we're saying that possibly the endometriosis has damaged her organs, this could be, for example, if there's cysts in the ovary. So it means that those cysts contain blood. Now, those cysts are not supposed to contain blood. They're simply supposed to contain a space where the egg is able to develop. And at the time of maturation and ovulation, the ovary releases that egg. If it contains blood, if it's been damaged by endometriosis tissue, it can't do that. That affects ovulation. So already that affects a woman's chance of getting pregnant. What if the patch, the endometriosis tissue, has affected the fallopian tube, and it's made the fallopian tube stuck to the ovary, or is stuck to part of the wall of the womb? We call it the peritoneum, but it's actually the cavity where the womb and all these other organs sit. If it's done that, that means the fallopian tube might be blocked, and so the egg can't even travel. If ovulation has happened, the egg can't even travel to where it's supposed to meet the sperm for fertilization. So these are some of the things that can happen in somebody with severe disease. But in somebody who doesn't have, the thinking from research is that the whole condition, endometriosis, can lead to a woman having poor quality of eggs. So if she's got a poor quality of eggs, that might mean that getting pregnant is difficult. And this is now, I'm looking at reasons for which women who don't have severe endometriosis may have difficulty falling pregnant. Okay, for women who have severe endometriosis, we've said it can be because there's a damage to their organs. I've just explained that. But if she has mild, or sort of not as severe as other women with severe disease, it could be something to do with the poor quality of eggs that happens simply because she has that condition, endometriosis. We've talked about how traveling in the egg, traveling in the tube can be affected by endometriosis because the fallopian tube is damaged. But there may be chemicals, hormones being produced in an irregular manner because of endometriosis that also affect how well the egg can travel. It can even cause endometriosis, can cause inflammation in the pelvis, which affects the sperm. It might kill the sperm or cause tissues that will destroy the sperm to develop. And if that happens, of course, the sperm cannot fertilize any egg. And in some cases, they think it may be because endometriosis can prevent ovulation from happening altogether. The mechanism, they don't really know. We're not really 100% sure. So I'm sharing with you different possible reasons. I'm saying to you that we still need a lot of research to understand why and how endometriosis can affect fertility. Research is ongoing, but you know how research goes. It can take time, and of course, it needs a lot of resources. But these are important questions that we need to ask because of the impact of fertility, and considering that this is a very relatively common condition that women can have. Okay, I'm just going to have a quick look on the chat. I know there are a couple of people here. Well, thank you so much. I'm sorry about my lighting today. It's not very bright, but yeah, I've got the window open, but who knows? Okay, so let's carry on. I think we are on question number 6. So we are now looking at why endometriosis happens. Somebody may ask why endometriosis occur. So we don't know. I like to be very upfront about these things. Still so much about our human body that we don't know. So we don't know what causes endometriosis, but there are some suggestions or theory, call them theories, some ideas. The thing about these ideas is they could sound reasonable, but they don't apply in every case. Before you can establish and say this is the cause of something, it means that in every single instance, this reason will explain it. But because these theories don't explain it in every instance, that's what they are. They're just theories. They are suggestions that it may be this. And sometimes it may be a combination of these different theories. I'm going to quickly talk you through them so that you can understand. And I think I want to start by saying it is nothing that any woman has done. It's nothing that you did or didn't do, or that a mom did while she was pregnant or didn't do while she was pregnant. It's not something you catch like a sexually transmitted disease. And I'm by no means not trying to blame anybody for picking up a disease or not, but just to be clear in our heads when we're thinking about endometriosis, because the important thing you want to look at is how can I prevent this from happening? And I think I'll talk about it maybe in the next episode of this series. Might look at the risk factors, what makes one woman more likely to get endometriosis compared to the next one. So let's look at those theories about why endometriosis occurs. So number one, and this is one of the most popular theories that if you know about endometriosis, you might have heard it, is that when menstruation is going on, during that time when the womb lining is being shed and the egg is, you're having your menstrual period, the theory is that instead of all that material leaving through the vagina, some of it escapes. And instead of traveling out of the vagina, it escapes and travels back into the womb, goes into the fallopian tube, goes back generally. So instead of traveling downwards out, let me show you one of my videos again to make sure that we understand which is the better one. Let's use this one. Okay, so the egg comes out and it gets into the space of the cavity, but it doesn't get fertilized, and so it's shed as blood. So it's saying that instead of going downwards, it goes back upwards and travels back into the tube and towards the ovary, and that way endometriosis can happen. So that is one theory. Another theory is that the blood vessels that supply the womb, they're so close to the womb tissue, they may carry bits of the womb lining as they move away. When we talk about blood vessels, we talk about the arteries, the vessels that bring blood to an organ, and we talk about the vein, the vessels, the blood vessels that take blood away from an organ. And that happens all over our body. So what we're saying is that when the veins are taking waste material away from the womb, that perhaps it carries more than waste. It's taking bits of the womb along with it. And as it moves around the body, it's spreading these bits of the womb lining. Well, that's a theory. I'm not saying that's the definite cause. I've explained why there are theories. We don't know for certain. We're still sort of thinking around how this thing happens. The next theory is that this, as we said, this tissue is similar. We're not saying it's exactly the womb lining. Again, we're not sure, but there's a theory that this tissue is not the womb lining. It looks like it behaves like it, but it's not the womb lining. And they say that it is not the cells of the womb. They are cells from another part of the body that then develop to look like this tissue that behaves like the womb, that is responsive to these hormones, estrogen and progesterone. So they're saying that this tissue normally would have gone on to develop into other types of organ in the abdomen. But for some reason, something happens and their change becomes into womb-like tissue, which is, and they form, and because they're outside the womb, that's obviously abnormal. So that's the third theory that scientists hold for why endometriosis happens. And there's another theory that looks at a problem with the immune system. And that theory suggests that, well, within the cavity, there are some cells that are supposed to destroy any kind of, if accidentally this womb lining or blood cells get into that area, some cells of the immune system are supposed to get rid of them before they can start causing any trouble. But there's a problem with that process. And so they think it may be a fault of the immune system. Like I've said, still a lot of research is needed in this area, but these are some of the thoughts. I think the key takeaway is about being conscious that we don't know why this happens. We can't say it's because of that or the other. There might be some conditions that may put a woman more at risk than others, but at the moment, still a lot more studies necessary to help us get to the bottom of this thing. Okay, so the next question, and I am checking the stream. If you've got any questions, I'm happy to take questions. If you want to share a comment on perhaps your experience, what's happened to you in the past with endometriosis, maybe a challenge with getting diagnosis, maybe how long it took for anyone to take your symptoms seriously, whether it's family, friends, or doctors, because women talk about experiencing very heavy periods and their families or partners don't think that, you know, they're being it's all in their head. They're not taking their symptoms seriously, or they go to the doctor over and over again and it's just heavy periods, you know, live with it. Please, let's, you know, share your experience. If you're comfortable doing that, it'd be great to hear from you. So the next question, as we start to as we look at this particular topic, what endometriosis looks like. I think by now, if you've listened from the very beginning, you have a sort of good idea of what endometriosis looks like in terms of the number of people in our society that it affects, what kind of a condition it is, the symptoms and the pressure, the burden it can carry. And I just wanted to emphasize this. It affects 10 to 15% of women of childbearing age, women who are in their reproductive age, women who are menstruating, who can still have children. 10 to 15%. That's a big number. Fair enough, probably not as big as fibroids. You know, if you go and look at our fibroids videos and fibroids playlists, we talk about that to such a great extent. And we can say 1 in 3 women, you know, could have fibroids. Many of them may not have symptoms, but a good number of them do have symptoms. So these conditions are comparable, but endometriosis is actually more common than we think. The other thing I thought was interesting in terms of what endometriosis looks like is there isn't a particular race distribution. There isn't, oh gosh, what's the best way to put this? So basically in fibroids, we tend to see it a lot more often in women of African or African origin or descent, Afro-Caribbean, African-American or African origin, or women from of African background tend to experience fibroids more, something that we still do not have clear reasons why. Another area of research, why does it appear more common in women with African backgrounds? You don't have this kind of distribution in endometriosis. We haven't noticed that in terms of which race or ethnicity might have this condition more. Again, something that's of interest, really, something that we're still studying. And I will still look through studies to look at what kind of distribution in terms of how common is it. Do we know why certain women are affected more than the other? But certainly compared to fibroids, you don't have that kind of broad distinction or distribution of this condition. Now, let's go to a very interesting question. And that is, will endometriosis go away? Will it go away? So we've said, and I think I've pointed out to you already, that, let me get a drink, my mouth is getting a bit dry. So we've said the growth of this endometriosis tissue patches or cysts, wherever they are, comes under the influence of hormones, especially the hormone estrogen. So this is one thing that we're aware of. Endometriosis doesn't have a cure yet. At the beginning, I said it's a chronic, lifelong condition. So what I meant by that is if a woman develops endometriosis, she lives with it and its complications, and it carries on throughout her life. So we don't have a cure, but we do have treatments. So the answer to that question, will it go away? It doesn't go away. If it causes problems, if it's causing problems with pregnancy or getting pregnant, if it's causing pain or any of the symptoms that we mentioned in response to the earlier question, then we need to do something. And there are treatments that can usually address troublesome symptoms like painful cramps, periods of fertility issues. And the aim of these treatments is they try to create a scenario like pregnancy where a woman is not menstruating. That is what shuts endometriosis off. Remember, I said at the beginning that the impact of the hormones estrogen and progesterone on the womb lining means that at certain parts of a woman's cycle, the womb lining becomes thicker, and then at certain points, it now thins and is shed, okay, as menstrual blood. And that's exactly what's happening to the endometriosis tissue. But if you can create a situation where a woman seems to be pregnant and she's not having periods, then you can at least deal temporarily with the problem of endometriosis. Because even after menopause, women can still have troublesome endometriotic tissue. Even at that stage where you think, okay, she's no longer ovulating, the hormone levels have gone down, some women can still have troublesome endometriotic patches or cysts and so on. And that tells us that there may be more to it than the effect of estrogen. Just have that at the back of your mind. But what about treatment? So the options for treatment, of course, are hormone-based. They want to regulate the symptoms like bleeding and painful periods. So one of the common ones that people will use is the combined oral contraceptive pill, the combined pill. Of course, this needs to be carefully monitored, especially if you have not established clearly that a woman's heavy periods is because of endometriosis. But you can use the pill to regulate the period for some time. And if that stops working or if that's not effective, then we should look for other treatments. And don't forget, in some women, it could make it worse. So that's why it's important for monitoring, for you to continue to have that sort of back and forth with your doctor. If it's not helping, we need to change this, or we need to be looking at doing some more tests to find out what we're dealing with, okay? The other thing that will be useful will be to suppress the estrogen hormone completely, making the endometriosis inactive using other forms of birth control. So that's using things like I'm just pulling up my screen so I don't miss out the last question. So the other thing is to suppress the estrogen hormone so that the cysts or the endometriosis tissue is no longer active. And you can also do that, apart from the combined pill, you can also do that using birth control like the Depo shot and the Mirena coil that goes into the womb. And there are other different hormone methods or hormone containing medicines that can modify or affect the behavior of tissues and reduce the symptoms with endometriosis. And lastly, of course, there is surgery, different types of surgery. I'm not going to go into detail, and I believe I have talked about it in one of my videos on the channel. Please go and have a look. So surgery is also an option to remove, if you find pockets of endometriosis tissue causing troublesome symptoms, the doctors can go in there and remove them. So that is a form of treatment for endometriosis. Okay, so I think we've looked at that. I believe that was number 9 question I was tackling today. Will endometriosis go away? So that leaves me with the last question, and I'm just going to be very brief on it, and it's about Depo Provera endometriosis. And I have mentioned this to an extent. I've made a comment on how Depo Provera can be useful for endometriosis, and it's one of those birth control methods that is licensed in some parts of the world, because what it does is that it helps to suppress estrogen. And apart from, for a woman who's got endometriosis, apart from using it as birth control, I mean, what you want in that instance is to control symptoms, really. So it can completely shut off the estrogen production in her body, and it means that she's not going to be having normal menstruation, and that calms down the symptoms. That can help to treat the symptoms. The thing to remember is that it's not a cure. So using the Depo shot in this manner is not a cure. It's a treatment in the sense that it controls the symptoms, and you can go around and do things, your day-to-day activity. So it's important that it may be what's required for a woman at a particular stage of her life. Perhaps she's not looking to get pregnant at that point, but she wants to do that in the future, in which case then the treatment option will have to change. It's very subjective. It depends on individual women. So guys, this is what I wanted us to look at in terms of endometriosis. This is just the first of our Q&As. We're going to be having a lot more. Please let me know what you think about this this new series. I'm looking to build up my database, my question database. I've got loads myself, but if there are any that you want us to address, please let me know and send response to this video in the comment section, and tell me what your thoughts are and what questions you would like me to tackle as well. Now, please make sure you go and check out the latest video that we published yesterday. I know I've been talking a lot about fibroids on the channel. I think in the last month, we've got maybe like 5 or 6 different videos on fibroids. But again, I think it's so important that we're having these conversations. And I was so happy to do this analysis video looking at a lady who shared her experience with fibroids and how she went from ablation therapy and went on to have a myomectomy and how things were doing afterwards. I think it's really good to just listen, especially if you have fibroids and you're thinking, what are my options? What treatment would suit me? What could happen? It doesn't have all the answers, no, but it tells the story from the point of view of somebody who has an idea of what you're going through and what her journey was. So please go and check out it. The latest video just came out yesterday. Let me know what you think about the video, and obviously share your own experience as well. Guys, I'm going to call it a day here. Thank you so much for joining me. And if you were there on the live, so much appreciate your popping in today. Thank you again to Sarah, who was watching from Sierra Leone. I would love to hear about how you're getting on. Obviously, if there are any other video content or video topics of interest to you, please do share with me. Don't forget to like this video, and guys, please keep on subscribing to the channel. We're aiming to go past the 10,000 mark, if possible, before the end of this year. That would be fantastic. That would be a great Christmas present, and I know that we can do it with all your support. So my friends, thank you so much for watching. I hope you have a lovely weekend. Stay well, and I will see you again next time. Bye-bye.